Okay. Good afternoon, ladies and gentlemen. Ramadan Kareem. I hope this is a blessed month for all of us. I am Dana Al-Kahlout, Senior Program Specialist at the Doha International Family Institute, and I welcome you to our first webinar on In Families We Trust, Understanding Qatar's Family Strength. To speak on this topic, we have two exceptional speakers. Ms. Sajida Atari is an early childhood development specialist at UNICEF Jordan Country Office. She leads UNICEF's nationwide parenting support programs on strategic, technical, and operational levels. Prior to UNICEF, Sajida served in various technical and managerial roles, managing ECD and disability-related initiatives across Jordan. She has translated and published several academic books on ECD from English into Arabic, which are being taught in universities in Jordan and the region. Sajida holds an MA degree in early childhood education from the University of Texas at San Antonio, where she was the recipient of the Presidential Honors Scholarship, in addition to an MA degree in special education from the University of Jordan. And she's currently completing her coursework for a certificate in early intervention at Georgetown University in Washington, D.C. Ms. Aisha Sultan is a researcher at Doha International Family Institute. She participates in designing, developing, and implementing research projects that focus on family well-being at the national, regional, and international level. Prior to joining DIFI, Aisha was a participant at Qatar Research Leadership Program, where she underwent training in linguistics from Dr. Zainab Ibrahim before attaining her MA. She holds a BA in Foreign Services from Georgetown University School of Foreign Service in Qatar, majoring in culture and politics, and MA in linguistics from University College of London. Welcome, Aisha and Sajida. I think the three of us are Georgetown graduates or working towards our Georgetown degrees. So to everyone else out there, we'll be monitoring your questions on the Q&A platform. Feel free to post what you'd like, and we will aim to address your questions at the end of the discussion. So to begin, Sajida, could you please explain to us what are family strengths?
Thank you so much, Dana, for having me. And let me start by wishing you all Ramadan Mubarak. May Allah grant us health and strength. And speaking of strength, let's all agree that all families have strengths. And all families also have challenges. But what most importantly is that all families have areas of potential growth. And when talking about families and even studying about families, we can either focus on family problems in an effort to answer the question, why do families fail? Or similar to this webinar, we can take a family strength approach and look at families who are doing well in life and answer the question, how do families succeed? So in order to identify the qualities that make families strong, there have been a number of different conceptions of family strength and positive family traits. And despite some disparities between the models, researchers in general around the world have found remarkable similarities in families in different cultures. And what is significant is not how strong, how different strong families are in the global community, but how similar they are. And so there are, many complex and sophisticated models of family strengths. In UNICEF Jordan, we have identified a basic, straightforward approach to guide our family support interventions. It's the family strengths model, or the family strength perspective, which basically describes strong families in 6 clusters of qualities. And these are more or less like themes of strong families. And just to quickly go through them, so we believe that strong families are the ones who express appreciation and affection towards each other. They deeply care for one another and express love, for each other. Adult members, they lead by example and, show the children how to use appreciative language and gestures. Strong families also, they have a strong commitment to each other. They make their relationships as high priority, and they invest time and energy actually for one another. The third thematic theme is that these strong families, they spend actually enjoyable time together, meaning that they plan to spend time together. They spend time together and they actually enjoy it. The fourth theme is that these strong families have effective and positive communication patterns, which means that they spend time actually talking to each other, listening to one another, and they stay connected. Even in some families, they even go to setting some, ground rules on how they communicate in respectful and loving ways. The fifth theme or quality which is interesting, is that strong families also have a sense of spiritual well-being. Perhaps this can be a little bit maybe controversial, but researchers actually argue that regardless of the religious orientation of a family or how they would express their spiritual lifestyle, strong families actually have consistent themes of guiding values and ethics, and they have a joint commitment to important causes. The last point, which is on how strong families can manage stress and crisis effectively, how they have the ability to adapt. They're able to cope with difficulties and crises, which means that they are resilient. These families are not immune. They're not exempt from life hardships and challenges, but they are mindful. They're mindful of other, of their family members, whether they're going through stress. They pull, each other together rather than letting each other fall apart. So taking a family strength perspective, or viewing families from a positive perspective, this doesn't mean that we ignore problems. It means that we reaffirm families' capacities and connections, and this is actually grounded in research. So when we think of all these strengths, it's all important and to be taken into consideration for us as, when programming, when we work with families, and to keep in mind, to translate all these, strengths into, some considerations that needs to be taken seriously. So, for example, we need to be reminded that when we look for problems in a family, we will only see problems. But when we also look for strengths, we will find strengths. The second point, which is very important, that it's not about structure, it's about function, meaning that we cannot, judge a family strengths based on, their based on a certain structure. We can see strong, female-headed families, strong step families, maybe strong nuclear families or extended families. Likewise, maybe every type of family structure in the world maybe could have, might not be also functioning well. So it's not about, the structure, it's about the function. And this is where comes the cluster of qualities, or the themes of strong families come important. Another consideration is that, crisis, yes, maybe they do tear families apart, but also they can also bring make family relationships stronger. And we see that sometimes family in crisis, they forget their strengths. And this is where they need to be reminded of their strengths. This is where they need the support. And we have seen some really great examples of family strengths during the recent, for example, coronavirus outbreak or with the refugee crisis. Just to put all this together into perspective, and also and see why it's important for all of us to be aware of the qualities that makes family strong. It's important for us, for example, as educators or in programming, that when we are aware of family strengths, it's important that we develop programs that capitalize, family strengths. For targeted and specialized interventions, such as maybe family therapy, it's important to be aware of these strengths so that therapists can create, intervention strategies that help family members develop their strengths. It's also important for family policymakers, who can then, by this knowledge, can design, national policies and programs that enhance, families' well-being and, instead of diminish it. And the last point is that this knowledge also is important for families themselves, for family members, who can, by this knowledge, can, build their family strengths and in practice in their daily lives together. I can't hear you, Dana.
Thank you, Sajida. There we go. Very interesting, talking about the qualities of what makes strong families and how all families have similarities with regards to family strengths. And taking it from there, what are the challenges that families face in realizing their potential?
Yes. So yes, we talk about strengths, but challenges is another reality. And because, we know that all families face challenges from time to time. But what is important is that how families actually respond to challenges, how to mitigate risk factors. It's going to be difficult to list all challenges that families can face. There are many examples, either like separation, going through separation or divorce, maybe parenting issues, trying to find effective disciplining practices, maybe trying to balance between work or school and family life, maybe unemployment and financial problems, illness or disability of a family member, maybe death of a family member, maybe domestic violence. And we can think of different kinds of violence and abuse that could be either physical or psychological. It could be between spouses, it could be between parent and child, it could be with other family members. So there are certainly a big number of challenges that we cannot all list. So what matters for us is to understand how challenges really affect the families, and to understand that, like, for example, if we think of, maybe one problem or one challenge in one area of family's life can actually affect other parts in that family's life. Maybe sometimes some problems can actually drain a lot of the family's energy and their coping, resources, so that the family can get to a point where they're not able to deal effectively with challenging situation. And this is where the importance of understanding risk factors, because actually risk factors, they hinder, the family's resilience. So it's not necessarily that these factors will always result in challenges. Actually, maybe factors in one family may not lead to a challenge in another. However, risk factors have a cumulative and interactive effect. And this is because not only do the effects of risk factors accumulate, but because the factors also interact with each other. So the effects of one multiply the effects of another, and so on. So the family, we can imagine that a family that's exposed to several risk factors is considered a high-risk family. There are different kinds of risk factors, and they can be categorized or grouped in different ways. But here we can name maybe or think of some key ones. There are risk factors that are related to the parent or to the caregiver. It can include, for example, personality, maybe characteristics, maybe substance abuse, maybe history of maltreatment, maybe parenting stress, poor parent-child relationships. So there are so many that are related to the parent or the caregiver. There are family-related risk factors, such as domestic violence, for example, or maybe single parenthood, financial stress, social isolation. There are child-related risk factors that has maybe to do with the child's age, child's development, or maybe the child having special needs. The last maybe form of risk factors could be related to the environment, where the family could maybe going through poverty, unemployment, or so on. So just to maybe shed some light on some of the risk factors that are related to the family, and to give an important example of ineffective parental behavior. There has been some studies that really, and we see this on ground working with families, that inadequate family dynamic actually caused by poor parental practices, such as lack of supervision, rules that are too permissive, discipline that is maybe too strict, maybe weak bond between the family member, or inability to establish clear boundaries from the beginning. They are all risk factors, identified as all risk factors for risky behaviors, maybe drug use, maybe poor academic performance among adolescents. And therefore, adolescents coming from families characterized, for example, by lack of order or discipline are actually 4 times more at risk of engaging in risky behaviors as adults than those coming from structured families. So now, we cannot really focus only on these risk factors because research also indicates that risk is not predictive because of protective factors. So protective factors are also of equal importance. We cannot really get to good outcomes for children or families only by focusing on reducing risk. Positive factors actually buffer the impact of what researchers call toxic stress. And this is why we, in programming or policy making, we need to protect families against risk, but we also need to promote positive outcomes. And there are different, there are different kind of protective factors. The top key ones are the ones that support families to nurture social and emotional competence with their children by providing children with an environment and experiences that enable the child to form close and secure adult and peer relationships. This is the environment where children are allowed to experience, regulate, and express their emotions. Another protective factor is how to support families to incorporate social connections, because families cannot live in isolation. They need to have healthy, sustained relationships with other people, even with institutions and with the community. A third, protective factor is having concrete support at times of needs, similar to the times that we're going through now. Families need to be able to identify, to access, and to receive services either needed for them, for the adult members of the family, for the child, or for the family as a whole. And these services needs to be at quality. It needs to be designed to preserve parents' dignity and also promote healthy development for the child. The last maybe two protective factors, which we're all familiar with, is through increasing knowledge of parenting and child development for parents, helping them to understand, child development, how to implement appropriate parenting practices, how to adopt non-violent disciplinary practices. And the last protective factor, we're all now, our minds is all combined with the virus, is how to help families to maintain and improve their resilience. Resiliency is the key factor that actually helps, parents and family to manage their general life, their parenting stress, and also deal with stressors and challenges and adversity when they face them.
Thank you, Aisha. Thank you, Sajida. Very interesting talking about the risk and protective factors. And I think most importantly, taking out of it is that not only should we protect families, but also promote positive behavior. Thank you, Sajida. Aisha, how can families thrive during hardships?
First of all, thank you, Dana, and I would like to welcome everybody who's joining us today. And thank you, Sajida, for laying the theoretical background for the family strength perspective and putting things into perspective well. I would like to take the discussion a little bit more to make it more focused on the Qatari family. So based on 2 studies that were conducted by DIFI, the first one was on the strengths of the Qatari family or the Arab families in Qatar, Jordan, and Tunisia, which tried to identify the characteristics of these strengths and challenges that face the families. The study identified the Qatari family strengths as commitment, support for each other, communication, conveying values, family resilience, and demonstration affection and love for each other, which are a lot similar to the things that Sajida has mentioned. So as we see, families are, in a way, they're similar all around the world. But it's all about, as you mentioned, reminding ourselves of our strengths and using them to overcome the challenge and any hardship. And I think that the first step in overcoming any hardship is accepting and acknowledging that the family is going through a hardship in order to use our energy into overcoming and meeting the needs of this challenge. The second thing would be open communication in order to receive support from family members. When you know that there is somebody out there for you who's willing to listen, willing to support you and not judge you, you'll be able to overcome any, let's say, mental struggles or any anxieties or fears or frustrations. And one should be also very explicit about one's feelings. If I'm anxious, I should be able to communicate it to my family members in order to receive support. In addition, families need to seek help. If they feel that they need help, just go seek help from professionals, not be ashamed or try to keep it to yourself. Be open, and especially in this time, we are all in the same boat. We are all facing maybe the same challenges and struggles, so we need to be able to communicate it and receive the support that we need.
Thank you, Aisha. So you talked about calling out for support, and families should try to seek help when needed. What action can be taken to support families?
So to start with, the institutional support for family in Qatar already exists, and there are different institutional bodies and entities that already undertake this responsibility. I'm going to start, of course, by DIFI and mentioning what the work that DIFI does to support families in Qatar and to support the family cohesion. We in DIFI, we conduct research and we provide evidence-based policies and recommendations for the different institutions and decision makers in Qatar in order to promote for better family policies that affect the family on different levels. In addition, we have also the Ministry of Administrative Development, Labor and Social Affairs. They help a lot different families in Qatar, and they provide different programs as well. In addition, they oversee the national strategies, which have a pillar on social development, which includes the family specifically, and by which they see how the different institutions in Qatar can contribute to enhancing the family well-being. In addition, of course, to our partners, Qatar Foundation for Social Work and its different centers, such as the Family Counseling Center or the Social Protection and Rehabilitation Center, Aman. They already offer services for different segments of the society and for the different members of the families. Their services already exist, and they have also hotlines for people to seek their help whenever needed from professionals. They have also different programs that people can make use of. So as I said, the institutional support is already there, but people need to seek it. And also I would like to highlight the very important and very beautiful thing that is going on right now is the communal support that we see, either on the ground or, for example, on the social media and the different online platforms. People are trying, everybody on, like with their own capacity to help people, let's say artists, therapists, trainers. They're providing online free trainings, consultations, they're doing like music concerts, they're doing everything in their capacity just to make people feel better. So I think it's beautiful to see how humanity is bringing us all together, where we're trying to help each other in whatever way we can to overcome this hardship together, like with the least effect on our mental health.
Thank you, Aisha. That's true. I think there have been a lot of positive sentiments given the current situation. And I think that brings us to our final question. So I'll go back to you, Sajida, on this one. How does COVID-19 impact family strengths and challenges?
Well, first of all, I think we all agree that the COVID-19 pandemic is, as we all know, is more than a health crisis, and it has significant socioeconomic impact that, if affecting everyone, actually, it's more seriously felt by vulnerable families and children. So in the MENA region, for example, there are many countries that face a difficult balance between between restricting the spread of the disease whilst limiting the socioeconomic impact on the country, and taking this from the family perspective. where we're seeing more, families feeling stress and anxiety. And this is not only, adults who's feeling that, but also children and young people who are also impacted greatly by the current situation. The majority of parents and children all around the world actually have found themselves living in a new reality. So in many cases, confined to their homes without their normal access to services, which for many actually comes on top of their already limited access to health, protection, learning, play, care, even parenting support programs. Children and adolescents in specific, maybe they might be developing mental health issues in the form of stress and worry and anxiety. And what could be worrying children and young people the most is actually their uncertainty of their family's financial status, or maybe their uncertainty of their ability to continue learning and maybe being adequately prepared for future employment. Elderly, of course, one of the most vulnerable people during this pandemic. And in general, this pandemic actually affects the household in general in terms of the parents' income, who might not be able to work regularly due to business shutdown, layoffs, or maybe absence of childcare services. We have a child protection aspect here, because children will likely actually face increasing threats to their safety and well-being. This includes maybe mistreatment, gender-based violence, exploitation, separation from caregivers. And actually recent anecdotal evidence from some countries points to a significant actually rise in cases of domestic violence against women and girls. Not to mention that since schools are now closed, parents are struggling as they're trying to cope with the stress and continue their children's care and learning. So in a time like this, family is the anchor that can help children and young people cope with stress, with their stress and fear. And yes, family can be the greatest source of support, but also under unfortunate circumstances like we're going through now, they can become actually the greatest source of harm. And this is why children's well-being is therefore strongly linked to parental well-being. And this is why it's important, extremely important, to support all families while providing targeted support for the most vulnerable in order to keep children protected during the coronavirus outbreak.
Thank you, Sajida. Aisha, do you have anything else to add on how does COVID-19 impact family strengths and challenges, specifically with the case of Qatar?
Yes, so I want to, as you said, I want to bring it back to talking about Qatar, and Sajida mentioned the child perspective on this issue, and I want to mention the perspective from my generation and based on our reports. So some of the challenges that were mentioned is, for example, the societal change and the generational differences and the isolation of the youth. And I think one of the things that COVID did is transforming some of these challenges into a very positive, having very positive outcomes. For example, and I'm talking about, as I said, my generation and our perspective, a lot of us were actually facing social isolation or social distancing from our families, but it was a chosen one because we spend most of our day at work or with our friends or doing some other hobbies, and the time that we spend with our families is limited. But now with the forced social proximity, I hear a lot of my friends saying, oh, I actually spend more time with the family and I think I like them. They seem to be good people. So it's like people are getting to know their families again very well, and they're understanding or re-appreciating their families and their relationships and their bonds. So that's a very positive change that happened. Another thing is also the issue of the absent or disengaged husbands and fathers. So, and this is applicable maybe for a lot of the Gulf countries. Men do spend most of their day out of their house at work or in the majlis, and they spend the very minimum time with their families. So they just take the role of the provider of the family. However, now they're going back and taking their role as caregivers as well and sharing their responsibilities with their wives, which is improving the marital relationship very well. And I believe that any couple who survive this lockdown are meant to last for life. So that's the bright side of this lockdown. But also, like, on the on another note, and as Sajida mentioned before, we have also the issues of the challenges of domestic violence. Although in Qatar we don't have any reported cases that we are aware of or published right now yet, but we see in the world that there is a lot of the news going out about cases of domestic violence against women or children. So that's a thing that need to be addressed and tackled to see how we can help such victims. In addition, also to the stress or the mental health aspect that comes with the amount of responsibilities and duties, especially for women who work from home, who work in home, who have to raise kids, who have to maybe also help their kids with their distance learning. So there's a lot of duties that need or responsibilities that need that the women are juggling during this time, which might put them under a lot of pressure, and they definitely need support from all family members.
Thank you, Aisha. A very concise point of view. Actually, I think it's called during the COVID-19 social distancing, what we're doing right now, but I don't think it's social distancing at all. It's physical distancing more than it is social distancing. So thank you both for extremely important discussion. I'll take it to the some of the comments that we have here. Okay. Yeah, I think Sajida, first question I'll pose to you. Is it true that extended families have more strengths?
I think maybe this is something that we discussed as one of the maybe misconceptions, that we cannot really judge family strengths based on their structure. Yes, there are protective factors, there are risk factors, there are many hypotheses that we can come up with. What is more important is the functioning, of the family, and how, whether they have what it takes to make their family strong. Meaning, for example, are they expressing, their affection towards each other? Are they keeping, open communication channels, and so on? So maybe yes, maybe no. It depends on the functioning of the families, and we might be surprised to see some of the families that appear from the outside to be the most vulnerable families to turn out to be very strong families in terms of functioning.
Very true. Thank you. Aisha, a question from Mr. Ken Chen. He'd like to know what are the statistics, the population basically, and the year conducted for the DIFI's research on family strengths.
So the report actually can be accessed through our website. He can access the report and read specifically the statistics. I didn't get quite the question. Is it about the population of Qatar, or is it the sample of our research? If it's about the population of Qatar, I think the count now is 2 million plus of population, but if he wants more details on the report itself, it can be accessed through DIFI's website.
Thank you. And I'll actually stick with you, Aisha, on the next question, because you already mentioned the aspect of mental health. So our next question says that QF work is highly stressing, and so are families these days. Mental health is a serious issue, but people avoid admitting to it due to social stigma. Does DIFI work with QF to offer mental health services for QF employees?
Okay, so just to clarify the role of DIFI, we are a research institute and a policy institute. We offer recommendations, we do research, we do field work, we study the situation, we study families, and then we offer recommendations for policymakers and decision makers. So we don't necessarily do workshops or work one-on-one with people or with patients. However, there are a lot of people and institutions, as I said, that offer such support. And if people, they don't want to reach to these professional on-ground institutions, there are also people, as I said, offering online services who are accredited professionals and therapists that people can reach out to and seek their help and advice.
Yes, thank you. Actually, one of the therapists that's also doing voluntary work is the executive director of DIFI, Dr. Sharifa Al-Imadi. So you can also probably get in touch with her if you have any issues that you'd like to discuss. Sajida, Mohammed Khalil asks, are there studies on how this pandemic situation is getting families to spend more time together and reinforce family ties?
I think from now on we will see more studies being conducted and published. At the moment, there has not been any studies on this specific pandemic in terms of effects on families. There are many anecdotal, data that has been collected, and I'll be happy to share some links.
Yeah, I think that would be great. Thank you. I'll actually stay with you, Sajida, on the next question as well. The question says, my understanding is that there's a gender and cultural differences in internalizing and articulating stress. Parents, specifically mothers, tend to be better at acknowledging problems and especially to protect their children. What tools are available to support fathers so that they can talk about stress as well?
This is a good question, and as a matter of fact, this is a challenge that we have been facing and we've been witnessing through parenting programs for many years. I mean, in Jordan and worldwide, where the participation of fathers in parenting and the engagement of male caregivers in general is still very minimal, so that we can expect and anticipate that in hardships and in stresses, it can be very difficult for fathers actually to talk about their stress and to be engaged. And this is why it's important that we, when we design intervention for example, in response to COVID-19, that these responses should be family-based and should not only be targeted towards one family member, especially now more than ever. If we have done it before, where our programs were only directed toward children or toward parents, now is the time to design, family-based interventions where more time and more effort should be towards families, activities where everyone can participate and express their feelings in different ways. It's not necessarily we should be expecting fathers to talk about their stress. There could be different ways and creative ways that would allow different family members to express their emotions and stresses in a unique and individualized way. And this is why, for example, we are seeing, as Aisha mentioned, and we see this in Jordan, more and more organizations are now have responded very quickly and started providing families with remote support, with the psychosocial support that is aiming to engage families who are interacting more than ever, and even happily posting their activities on social media and share them back with organizations. But this is a challenge that the pandemic has deepened further, is to engage fathers.
Yes, and I think fathers have been probably put under a situation now, like both of you mentioned already, that they have to be a part of this family and they have to take part and be fathers and husbands and etc. So, and at the end it works and families are strong and they're cohesive, especially under this scenario. Aisha, our next question to you is: the addiction of mainly parents and their children to mobile phones and social media impacting the bonds within families and the amount of attention that children are getting? Isn't this the main reason behind weak structured families?
Okay, to start with, to be honest, I don't have a background in psychology to be able to answer this question, but definitely the addiction to electronics is it's something that we need to look into, and hopefully in the future we'll be conducting a research on the impact of technology on the family bonds, because yes, families might be gathered together, but everybody is busy with their phones or on their electronic games, and they're not actually, they are together, but they're not actually spending the time together, talking, communicating, and building their relationship and their bonds. So it is an important thing to look into and to study more to understand the impact on the family strength.
Thank you, Aisha. Sajida, our next question from Mohammed Mahjoub. Could you please give us some more examples of what support has been given to families, especially children, under the COVID-19?
Yes, it's been really an interesting experience now that some organizations and like UNICEF was one of the very first organizations that responded to families in Jordan, because we've been going through full lockdown and curfew for over a month now. And the only way was to reach parents and families and children was through technology. And whether we liked it or not, it was, the only mean to reach them. The most important priority was for the country is to the continuation of education and children's learning. And this is why, we have seen that schools have started broadcasting, lessons on the national TV. But in addition to that, we have seen either international or national organizations establishing WhatsApp groups. I think WhatsApp groups has been very, very effective way in working with families. And I can share some of my personal example leading a parenting program where we worked through our network of national partners and we established WhatsApp community-based WhatsApp groups for parents and started providing families of children of different ages with content on the daily and weekly basis. So for example, for parents with children under the age of 6, they would receive on daily basis content that would have a short message for parents on positive parenting, like practical tips for parents on how either to manage stress, or for self-care or positive disciplining. In the afternoon, they would receive another message with a learning activity, something that they can do while they are at home with their children, using materials that would only be available at home. They don't even have to get anything from outside. And just to do basic, simple, fun, but meaningful activities with their children. And they are all, as I said, learning activities. Towards the evening, they would receive a third message with either a song for the children or a story, but all of these messages have been video recorded by our community volunteers, and they all show that these are all activities need to be done with the family, with the father and the mother, and the involvement of the siblings. Amazing videos we have received from the refugee camps. I mean, you would think that, the refugee camp could be the worst place now for having with such a pandemic where people are living in crowded places, no access to services. But going back to the family strengths and qualities, this is where you see real, the strengths of the family, how they can, when they have resilience, they would, overcome all kind of challenges. So other organizations have created WhatsApp closed Facebook groups and started providing, remote activities, some of them live, some of them in posting videos, and almost the majority of the programs has been actually adjusted and digitalized and provided for families in a very quick manner. And I think now it's a very critical time that we all learn from this experience and see how we can, prepare ourselves either for, God forbid, another maybe crisis, or how we can, capitalize on technology to reach, further, communities. There are some communities who don't have access maybe to internet or to smartphones, and this is where we distributed learning activities and resources with food and hygiene kits.
Thank you, Sajida. We have a final question, also on children, basically, from Shireen, and she asks, do you think loosening restriction with kids on the long term, as we don't know for how long this will be going on for, could work as a double-edged weapon on kids' behavior and therefore affect families negatively? And how about I pose this question to both of you and to hear from both perspectives? Aisha, would you like to start on this question?
Could you please, Dana, repeat the question?
Yeah, do you think loosening restriction with kids on the long term, as we don't know how long this will be going on for, could work as a double-edged weapon on kids' behavior and therefore affect families negatively?
Well, that's actually a little bit hard to answer because for me as a parent, sometimes you're faced just with the uncertainty, as you said. I don't know, should I be strict or should I loosen a little bit, because actually for kids, we don't know what's going in their minds. They might be struggling a lot, especially in terms of their mental health, because everything changed all of a sudden. Maybe for us adults, it's easy for us to understand and accept the situation and try to cope with it. But for them, many of them might not have the words or the right words to express their feelings, or because they don't know what they're facing actually. So it might be, I think we shouldn't be very harsh on them. We should try to set some limits, of course, but still also be a bit lenient, because every day they might face a new feeling because they're still locked up with uncertainty. For sure, they don't see their relatives, their loved ones. They're forbidden from going to play outside. So I think we shouldn't be very harsh on them and give them space to express their feelings and be open and be very sympathetic with them, because they need us this time the most.
Thank you. And Sajida, do you have, what's your response on this question?
Aisha covered a lot of important things. Just to add that, you know, I think what would really help is something that we all try to do ourselves and also encourage parents to do, is to set, you know, a daily routine. And this is something that we started by supporting parents from day one, and to do, as I said, to ourselves, is that we don't want to fall into the trap of not knowing, because we don't know how long, you know, this will take. It could be days, weeks, months, we don't know. Providing parents and families with tips and ideas on how to have and how to adjust, you know, their daily routine to this situation is one of the actually protective factors, because children know what they're expected from them, and parents know, you know, what's going to happen throughout the day. And we're so happy to see that, for example, the videos that we're sharing every day has become part of this routine. And because they go on specific time every day, parents actually started to organize their day around these videos. So that they, even when we don't send them, they would ask like, oh, you know, we haven't received the video today. Are you going to be sending something if something happens and we get delayed? So yes, we might, you know, be loose, you know, some you know, some of the restrictions. That's for sure. We need to be flexible. Yes, maybe we don't encourage children to spend time on screens and TV, but this is an exceptional time. We have to be mindful. We have to be careful when allowing children to lose some of the restrictions, still to do this to some extent, not just to make it, you know, open and available 24/7. So daily routine rules still would be very important and key for families, but definitely need to be adjusted and take into consideration this unexceptional situation.
Thank you, Sajida. Thank you both very much. Do you have any final comments to say? We don't have any more questions from the Q&A. Aisha, do you have maybe a final word to say, and then followed by Sajida?
Yeah, I think it will be interesting to keep an eye and noticing on how the family dynamics are shifting in all of our families, to see how the roles are changing and how everybody is maybe assuming new roles and contributing to the family differently now or more positively. So I think that will be very, very interesting to see. And again, I would encourage everybody to be as open as possible to each other, communicate with the ones you love, seek support if you need it, and be safe.
Sajida, thank you, Aisha.
Thank you. Maybe just again to be reminded, all of us who works in programs and policy makers, that to take family centered approach. Also to think of children of different ages, because both young children and adolescents are facing a very stressful time. It's an important time that we also look at the positives that Aisha have mentioned. This is a difficult time, but there are a lot of we are seeing a lot of great examples on how families actually are getting more stronger by the time. And just one last comment, I'm posting now, I'm sharing some few links, some links for few resources, useful resources, because, we can just keep talking about how parents or families need to do this or that, but if we don't provide them with tools on how, on how to do things, how to talk to their children, how to reduce stress, if we don't provide with the tools, they're not going to be able to put this into practice. So some of the links I'm sharing is either some practical tips or stories that have been published recently that parents can use, or some family activities, in addition to the theoretical part that I have shared earlier.
Thank you, Sajida. And I'd like to also point out about links that Ala Al-Khani has also shared a link on some valuable resources to support parents during the COVID-19. Thank you both for an extremely interesting discussion. I think one of the most important things to take out of it is that all families have strengths. These strengths might be different. It doesn't matter what structure the family takes on or what shape it takes. They will still have strengths, but at the same time, we should be mindful of the challenges that families can face, especially during hardship and during times such as the current times of the COVID-19, the challenges that they may face, in addition to the strengths and how they're coming together and becoming stronger as a family and as family units. So Aisha, Sajida, thank you both so much for your time. And thank you to everyone for your questions and everyone else for attending and for being part of our discussion. That's a wrap. Thank you.
Thank you so much.
Assalamu alaikum. Thank you so much, and we're very happy to see you, Ms. Sajda. Thank you, Dana, and thank you, Aisha.
Thank you.